COVID-19 created the perfect storm for eating disorders among young people. Western Mass News reporter Mary Wilson explains how the pandemic unmasked and exacerbated this public health crisis.
Layla Plante has been battling an eating disorder for years. She and her stepmom Karen check in at Walden Behavioral Care's Amherst Clinic, where the 13-year-old is getting help.
I was always afraid of the texture. I really still am anxious about crumbs. I never liked pizza.
Layla had always avoided certain foods, living on applesauce and oatmeal, but last year it came to a breaking point.
It really hit us in the beginning of COVID. She had a lot of, stress and anxiety with the changes in school and remote school, and she lost a lot of weight.
Layla's weight got down to a critical level, and Karen feared for her daughter's life.
She put on leggings one day, and they were falling off of her, and leggings, usually are a bit more snug. So to see that, and she had her eyes were sunken in, her coloring was very pale. She just didn't have a lot of energy. It was really scary to see.
Karen made the call for help, and Layla was put into a specialized program for kids with ARFID, Avoidant Restrictive Food Intake Disorder.
Is less about the way that they look and more about either, fear that they might get sick after eating, or the taste of a food, or the look of a food.
Licensed clinical social worker Amanda Smith says Layla entered treatment at a time when monthly inquiries into Walden's 10 clinics doubled.
The world went through something really major, and how do we cope, right? For some, it's not eating, lack of appetite. Others, it might be eating more. And so we really saw how folks were trying to cope through this pandemic, brought up maybe some of those maladaptive coping mechanisms that they had just blossomed.
The CDC found emergency room visits for eating disorders doubled among girls ages 12 to 17 during the pandemic. In Massachusetts, 9% of residents will develop an eating disorder in their lifetime, and 10,200 Bay Staters die every year as a direct result of an eating disorder. That's one death every 52 minutes. Smith says parents should watch for subtle changes in behavior.
Suddenly now, your adolescent who loved to eat dinner doesn't want to eat with the family anymore. Maybe they're eating, by themselves in their room. They don't want to take their sweatshirt off in front of others, or as warmer weather comes, they're staying more inside or bundled up.
And though it may come from a place of concern, saying just eat is never the answer.
I think it can be really hard, though, to continually hear just eat, or it's just a burger, it's just a snack. It's not. It's so much more than that.
And Layla's condition goes beyond just being picky. Therapy is helping her get to the root of the problem and identify coping skills.
That's where I started to really change and develop into a new person.
She went from avoiding birthday parties and holiday dinners to trying and even cooking new foods.
Now you were telling me your list of life.
I love rice pilaf so much.
So much longer.
Family support is key. As part of treatment, Karen got support from other parents going through the same thing.
It's hard to see someone you love struggle through an experience like this. It's painful, and that's why we wanted to help get our story out, so that way other people can understand that there is hope and that it does get better.
Her wish is that Layla will lead a healthy, independent life, and that the rise in eating disorders over the pandemic also leads to increased awareness and people getting the help they need. Mary Wilson, Western Mass News.